Hi everyone, hello. I'll wait for a few seconds for everyone to join.
We've got nearly 90 people already, Chloe.
Yeah.
There we go, hit 90.
Good. Numbers.
Cool, so yeah, hi everyone. Welcome to the Navigating the New CQC Assessment Framework webinar. We know this is a pressing matter for everyone in social care due to all the changes that are happening. There's a lot of uncertainty and confusion, which is why we've created this webinar to be able to support you with more information and guidance. It's great that so many of you are able to make it. My name's Chloe. I'm the Partnerships and Events Manager at Log My Care, the most user-friendly care management platform. And with me on this call, I have Sam Hussain, the founder and CEO of Log My Care, and Mark Tops, Regional Business Manager and the co-founder of The Caring View. So today we'll find out more about some of the core changes CQC is implementing with the new framework, how these changes will impact care providers, what you should avoid doing, but also start doing during this time, how a digital social care record can help you, and of course, at the end, we'll have some time for questions and a short Q&A. So please add your questions into the chat box on the side. Before we get started, a little bit of housekeeping. The webinar software we use works best if you have one or two tabs open. Otherwise, you might see some video stopping and delay. So ideally, if you have a lot of tabs open, close a few of them if you can. But that's everything. With that being said, let's get started. So over to you, Sam and Mark.
Cool, thanks, Chloe. I guess I'll kick off, Mark. Just to say, look, it's really great to be doing another one of these sessions and to do one remotely. We, of course, did one together with the Caring View back in October at the Birmingham Care Show. So some people might have been to that, but really great to be able to, speak to a wider audience today about such a big topic as this. So my name is Sam. I'm the founder and CEO of Log My Care. We are an electronic care planning and medication platform for the social care industry. We set up 6 years ago in response to seeing how much data entry and time was required to keep the right side of the regulations, and overall how hard a job it was to do that, all that paperwork. So I hated seeing staff having to stay late and do paperwork after hours. And that was the catalyst really to starting Log My Care. We started developing the product itself because the alternatives were very hard to use and needed a lot of training and support. And being an engineer myself by background, I really wanted to make record keeping a faster and more pleasurable experience. So Log My Care is fundamentally a highly modern and intuitive care planning platform. We focus on great usability and design, and that's why we're now used by over 1,200 care services across the UK who look after tens of thousands of people in their care. We're regulated ourselves effectively by being NHS assured, and I guess our dream state is to move to a world where technology can help make care both more informed and ultimately preventative as well. So that's quickly from me, but I'm delighted to have Mark with us here today as well.
Yes, thank you very much. Before I just do an introduction, I can just see in the chat there's a few people saying that the sound isn't working for them. I suggest probably trying to leave and then come back in and see if that works on your devices. Yeah, somebody said I've got such sound, check your setting. Yes, so for anybody that doesn't know me, my name's Mark. I'm the Regional Business Manager for Essex Cares. We are a reablement service provider in Essex and some of the London boroughs. I'm also the co-founder of The Caring View. So we are an online social care platform created kind of during the pandemic to be the voice for providers and more so registered managers. We have a live weekly live stream that talks about subjects to do with social care on a Tuesday evening. So tonight we're talking all things around AI in social care. We also have an exclusive podcast and free resources for the sector that go out every Friday. So if you want to know more about the Caring View, you can visit www.thecaringview.co.uk.
Or, of course, go to your YouTube channel as well, which has got tons of amazing free content there as well, Mark.
Yes, and I'm sure Adam will tell me to make sure I tell people to subscribe and hit that bell.
I'll do Adam's job and plug that for you.
Yeah,
but yeah, both the Caring Views are a great resource, and also all of the Log My Care blogs are available on our website as well. So let's move on from intros into, I guess, the heart of the big topic up front, which is what are the core changes and when will they start being implemented? So Mark, would you mind giving us just a brief overview? I know you've done a lot of research and thinking into this already. Yes,
so some of the services in the South went live this week on the 21st. So some of the key changes, we know that the CQC during the pandemic, they knew that they needed to change the way they inspect. Obviously, they couldn't get out to services and they wanted to utilise the digital solutions that we've got and data to inform outcomes. So it's probably easy to touch on what's staying the same because there's not much. So the 5 key questions, so safe, caring, responsive, effective and well-led are staying. And the 4-point rating scale is staying to a degree. So you're good, well-led, requires improvement. The PIR is staying, but there hasn't been any communication yet from the CQC around what that's going to look like on the new portal. So some of the things that are changing is obviously there's a new framework, the single assessment framework. So that is one framework for every service type that the CQC inspects. So GPs, dentists, and obviously adult social care. Like I said, the 5 key questions are staying, but underneath those are going to be some quality statements. So for each one of the key questions, there's 5 to 8 quality statements per key question. And it's really clear if you go on the CQC website on what those quality statements are. There isn't yet any kind of evidence suggestion on best practice like they have at the moment for the Chloe's. If you look on my LinkedIn, I have shared some ideas and bits and pieces around, and I know that the Log My Care ebook is also going to include some examples. So it's definitely worth thinking about kind of that now so you can start to transition into collecting that evidence. There's going to be the new portal. So we know the CQC have started rolling that out. So at the moment, they're running 2 portals, the one that we currently know well and utilise, and the new one, which is going to be the one-stop shop for us to do everything. So we'll be able to register as a new provider on there. We'll be able to submit our notifications, make changes to our registration, and manage our contact details. 2 real main changes, though, which I think are going to be really good for registered managers and work-life balance, is you're going to be able to delegate access to colleagues in an organisation. So if you've got a deputy manager, you'll be able to delegate that access to them while you're away. Because I know there's quite a lot of registered managers at the moment that might be on annual leave, but are still doing the notifications kind of in that annual leave time. And there's also going to be the factual accuracy checks that will be on that portal. So you will receive an invite from the CQC, so just keep an eye out. I think one thing I would advise is make sure that your contact details with the CQC are correct, so your email address, just to make sure that you actually receive it. So I spoke there about the factual accuracy check, and more details of that came last week. So there's currently 2 systems, a bit like the portal, one for the current framework of inspections and obviously the new way for the single assessment framework. It will be via the portal and you will receive your inspection reports. It won't be a PDF anymore, it'll just be a draft report online. And whereas with the old way, you used to be able to download their factual accuracy, fill in the document and send it back to them. On this, you'll be able to see the comments of each section of the report and you'll be able to make comments and upload evidence against each section. The CQC haven't confirmed whether there's going to be a word count limit. So it was spoken about and there was a lot of kind of backlash on the Citizen Lab, which the CQC have. So they haven't confirmed that. Hopefully there won't be. You'll be able to upload your evidence. They haven't confirmed whether there'll definitely be any sort of time frame at the moment. They have said that there'll be at least 10 days. So it could be more generous than what we see at the moment, but at least we'll have 10 days. But that'll be from the day that they send the email. So if you're on annual leave or for whatever reason that ends up in your spam filter, potentially you could lose some days by the time you actually retrieve it. So they've confirmed the types of corrections. So typographical or numerical errors, they're happy and willing for you to check. So job titles, if there's any kind of inaccuracy in data, and information that has led to a judgment which we as a provider believe is inaccurate, we'll be able to provide supporting evidence. All the evidence has to be from the current time frame of that inspection. So providers will have to be able to evidence that actually it hasn't been added in at a later date. It still links to the current factual accuracy check that you can download from their website paper version, which is sections A, B, and C. So you'll still be able to get a good idea of kind of the questions that they're going to allow you to check against. They have said that they will not use the factual accuracy check to challenge a rating or a score, how they carried out an assessment, or to challenge any enforcement activity they propose, which I think is quite interesting because I think under the current regime, there's obviously a lot of providers that might seek support from a solicitor's or a law firm to be able to challenge that. So going forward, what that looks like, we don't know yet. They are introducing evidence statements. So there's 6. So they'll be looking at people's experience, feedback from staff and leaders, feedback from partners, observations, processes, and outcomes. So they really set out the types of evidence that the CQC will expect to see and to understand the quality of care. So I just wanted, if I can, Sam, just to dive into those 6.
Sure, Mark. Yeah, let's go for it.
So this has recently been updated on the CQC website. So if you haven't seen this, I do recommend that you go onto their website and check. So people's feedback, they will be collecting that through phone calls, interviews, survey results, and feedback from public and voluntary groups. And I think that's one thing that I forgot to say kind of at the beginning, is that it won't just be utilising data that your service has, they'll be utilising data from any public source they can. So it might be from district nurses, it might be from Health Watch, it could be from your local GP. So for staff and leaders, they're obviously going to talk to staff that work within the service, your nominated individuals, the registered manager, but they're also going to speak to or look at evidence that might have come in from their feedback on their website, from whistleblowing alerts, and again, from staff surveys that you conduct. There's a big emphasis on the feedback within the organisation. So I think probably gone are the days of being able to do an annual survey with the people you support, with your staff, and maybe others. I think they're going to be expecting that kind of feedback on a more regular basis, but also looking at what you're doing with that feedback and the lessons learned. So looking at feedback from partners, we want evidence from people representing organisations that interact with your services. So that could be commissioners, other providers. If your staff are doing kind of qualifications, it could be accreditation bodies, any royal colleges for care services that might have nursing staff. And they have also said that they might use feedback from engagement events. Now, what an engagement event is, they haven't clarified. So is that from some of the things that we do within our community that they might end up turning up to, or is that their own engagement events and they'll utilise kind of the commentary that is on those live events? They haven't kind of clarified that at the moment. They remain committed that it's important to do direct observations. Those will be in the premises. On their website, they make reference to care homes specifically about this, but they might rely on other observations. So it might be if you've had a local authority inspection or Health Watch that have come in, they might utilise their inspection report to generate the data that they need and the evidence for your service. They're going to be looking at processes, so your policies and procedures, the audits, the learning that you've taken from the audits and the changes that you've implemented, your incidents and accidents, and any clinical records. And then a big focus will obviously be on the outcomes and the impact that we have to the people that we're supporting. So they're going to be looking at your physical, your function and psychological status to individuals and the care you deliver and how that impacts. They have said that they'll utilise vaccination and prescribing data, infection control rates, emergency admissions and mortality rates. So I'm assuming that they're going to link that back to obviously our provider portal, but also our data sets that we have to collect for skills for care and so on. So the CQC are changing in terms of what it looks like in the current structure. So at the moment, we have for some of us, we're very lucky that we have named inspectors. For some of us, we lost that some time ago, but they have made it clear that those named inspectors, if we have them, are going. So right at the top is the leadership team that are responsible for policy and driving change and standards. And under them will be 110 to 115 operational managers across England. Those will line manage geographical teams across 4 geographical locations. And then underneath them will be the frontline assessors, the coordinators, and those with specialist knowledge. And I thought I'd save the last big change to the last bit to mention before we go on to the next point, Sam, which is around scoring. So they're moving away from that single snapshot in time and are moving to assess the services on a more frequent, regular basis. What that looks like, they haven't determined kind of timelines and things. But the changes in evidence scores through those multiple different collection of evidence and data could amend a score at any point in time. So it means that the CQC might not necessarily have to make contact with you to be able to change your score. So in the simplest way to describe the new scoring process is they'll review the evidence within each quality statement and they'll apply a score to each category. They'll combine those scores for the overall category relating to each quality statement. So I'll break that down into simpler terms. Now, this is all on the CQC website. It isn't the most clear to get your head around. So, for example, if we look at the key question of SAFE, we know under SAFE there are 8 quality statements. So each quality statement can be scored from 1 to 4. So 1 being you're inadequate, 2 being requires improvement, 3 being good, and 4 being outstanding. So you've got 8 quality statements and you can get a maximum of 4 each. So that could give you a total maximum score of 32. So if they assess you on each, they're not going to do the whole quality statement. They're going to take little bits of each one. So it might be that they score you 2, 3, and 4, but 1 in one area. If you score that 1 in one area, you're limited to a requires improvement. And likewise with well led, it might be that you score 4 for all of the ones that they collect evidence against, but a 2 or a 3 in one area, that will limit you to a good rating. And I think that's where that factual accuracy check might be able to come in to be able to talk about actually the evidence that they didn't see on the day and how that plays into actually that outstanding rating. So they take that total score and turn it into a percentage. So the percentages at the moment are 38% is an inadequate rating, 39 to 62% would be requires improvement, 63 to 87% would be good, and 87% plus would be your outstanding rating as it's currently known. So I think we are seeing a shift between the number of services that are rated good and outstanding and more being rated kind of requires improvement. And I think this will probably continue with the new scoring. There has been some information released by the CQC on calculating first scores. So they are going to choose a quality statement based on priority for each service. They're going to pull some of those statements out of it. They'll collect evidence on those, and the ones that they didn't inspect, they'll pull over from your old inspection report under the old regime. And then, so if you've got a requires improvement on one of them, under the new scoring, you're only going to be able to get a requires improvement, and then you'll have to wait for new evidence to be collated. Obviously, it's a benefit if you're a well-led, outstanding service, because actually you're going to be able to pull some of that data and evidence over, even if they don't. So we know there are new areas they're going to inspect on. One is around the well-being of frontline staff, one is around sustainability, and they haven't released yet kind of what that looks like. They've said that they're working on that at the moment. I think one thing, if you go onto the CQC website, is they released a whole suite of publications under each quality statement. But at the time, in the early days, they say they were just going to be best practice guides for providers to be able to read up on and to kind of embed into their services. On the last update that we had from the CQC, they've actually said that they'll expect providers to have those embedded. So, for example, the DSPT toolkit has always been best practice, but going forward under the new framework, that's going to be a requirement. So presumably what that does for your scoring, they haven't said, but presumably you're not going to be able to get that outstanding rating and possibly that good rating if you haven't got that in place. I feel like I've waffled there, Sam.
Mark, look, I thought I'd let you get through it because there clearly are a lot of changes, and you know, you're the expert. So thank you for that really good overview. Now, from my side, actually, I thought I'd ask you a question which I didn't get to ask you in Birmingham, but it was actually for more of your opinion of whether these changes are kind of net good or net bad overall for care providers. And if I just, you know, look at it from a slightly removed point of view as a software supplier, but it seems that where in the old framework there was, you know, scores, ratings could be quite blanket applied, and there could be a lot of opinion that was hard to challenge within individual inspection reports. And we're perhaps moving to a world where, yes, more input and more data is required of care providers, but also there's more accurate and granular scoring coming through. So, you know, if there are areas to improve, that's going to be very, very clear and quite, you know, relatively clearer to dispute if you're going to try and dispute an overall rating. So it seems like, yes, maybe more work to do, or but at the same time more accurate and detailed reports. But I'm curious to hear what you think about it.
Yeah, I think for me, the services that have gone over to a digital solution, there's a lot of data we collate, but we might not utilize that. And I'm hoping that this new framework allows providers to utilize that data because it'll be benchmarked against other services. So the CQC haven't released kind of any more information on what the scoring will look like on their website. So in the early days, they had shared images of kind of graphs and benchmarking against local providers in your area, but also at a national level. And I think that's going to really allow services to actually dive in and say, actually, we scored here, but what are they doing? Because they've got a lot higher score than us.
And that's going to be through the portal, won't it?
It will be, yes, but they're also going to be releasing that publicly so that actually relatives can then easily benchmark against one another and removing that whole PDF document. And obviously they know that that's not accessible to everybody. I think providers that have been rated as required improvement and then are waiting 2-3 years for a re-inspection, hopefully those days will be gone because actually they're going to be inspected on a lot more regular basis. So actually improvements that they've made, they'll be able to then get into the good, which will then, you know, reputationally within your local community will be a lot better. We all know the impact that has if you're trying to get new customers and residents, and the challenge that requires improvement brings. I think there's nothing in there around training for me, which surprises me kind of under the well-being of staff that there's still nothing. So they're still leaving that to kind of provider discretion on what that training looks like for your team. I did think that there would be something. And I think training aside, I do think it will push standards because I think they're going to be able to utilize the data that they can collect from other sources, which as a provider, we might not be privy to. So we don't know how they're going to collect that data. So for example, if you've been inspected by your local authority, you would have a report, but actually are they going to get more evidence from that local authority than perhaps as a provider you see? And will they then be sharing that as part of the evidence in your report? And I think it could help drive the standards. And I think where we're going to be inspected on a more regular basis, you're going to be able to evidence that in those re-inspections and actually drive positive change. I think at the moment there is very much a culture if you're inspected and then you're waiting 2-3 years. So actually, do you make those changes, or do you strive for well-led and outstanding if you're not going to be inspected for 3 years? Whereas actually, if you know that there's a likelihood that you're going to be inspected within the next kind of 8 to 12 months, you're going to want to drive and push for that positive change within your service.
Yeah. And I understand that as a general CQC direction of travel, that they want to be, doing more regular focused inspections for those with, say, required improvements, and to an extent leave the people with good and outstandings, to a bit of data collection, but maybe even fewer than every 2 years inspections. Is that how you see things going?
Yeah, definitely. So they have said that it is risk-based, so they're obviously going to prioritise the services that are requires improvement. They'll then prioritise those that have got complaints that are coming into the CQC or a high level of safeguarding, because they're going to be able to utilise that data from the local authority safeguarding teams. They're also going to be utilising, and they haven't determined or stated what it is, but groups where relatives are involved in. So what those groups are or who they are, we don't know, but they're obviously going to be utilising feedback. So, touch with the pandemic doesn't happen again, but there were a lot of relatives that were calling out certain providers around their guidance and the visiting that didn't align with government guidance. And I'm sure that if that was to happen again, actually that would flag to the CQC a lot earlier than perhaps it did the first time round.
Mm-hmm. Awesome. Look, I'm sure there'll be a load of questions coming in, but to make sure we've got time for Q&A, let's move on to the next topic, which was, how will these changes impact care providers across different types of care? So this is an interesting one, Mark.
Yeah, so the CQC has said that not much is changing, and they're not expecting providers to have to start collecting a lot more data. I personally disagree, just from my own services that I oversee, knowing they've got the CLOE folders and the amount of evidence that's mapped against each CLOE to then obviously have ready for inspections, and actually being able to then take that out and put under the new quality statements. Whilst we might have that data, it's still going to take a lot of man hours to move that around and share that with teams. I think the framework is very baffling. When you join the CQC webinars, they're not always the most clear. There's a lot of unanswered questions. The website, and I spoke about scoring there, can leave you with more questions than you started. It's not in the most easiest way to digest. So I think there's a lot of work that providers will have to do to make sure that their teams are upskilled on what that new assessment framework looks like. There's no easy read at the moment from the CQC, so being able to have those conversations with people that might need that language in an easy read format. And then obviously you've got your relatives and your stakeholders that you might need to speak to, and again, upskill them actually on why you might be starting to do more surveys, or actually why you want to involve them more. I think the positive for me is that it will streamline things. So I think gone are the days where if you're a home care provider, you can't learn from a care home, and vice versa. Actually, we're all going to have the same framework. There might be slight individual tweaks, but on the whole, I think we should hopefully see the north-south divide that a lot of providers talk about disappear. So we know that the inspectors are going to be able to see each other's reports and how they came to those conclusions. And I think the CQC have also said that they want a centralised place that's going to look at all of those outcomes and utilise data in terms of utilising AI to see whether there's an inspector that might be slightly harsher or more favourable in any given area. So I think the changes are going to impact. I think there's a lot of work that we are doing. I think they're relying on a lot of data. So I think if you're a provider that hasn't yet moved to a digital system, actually how you're going to be able to collate all the data that you see once is going to be a lot harder, whether you keep that in a archive, off-site area and putting that back to slate, and then the cost that's involved in that. I think the CQC are saying there's not much impact, but I think there is going to be significant time impact.
So Mark, everyone's going to be on the single assessment. So there's, I suppose, a lot of standardization. across not just care, but GPs, dentists, they're all bring onto the same framework ultimately. But if I were a mental health service versus a learning difficulty service versus an elderly service, how am I going to get a different, flavor of the single assessment framework than others?
Yes, on the CQC website, there is guidance for each service type. So you can log on and have a look. They've released a lot more around kind of local authorities and NHS. So you can go in and kind of start looking at that now. I think it's just going to be a case of waiting to see when it happens. I know that I've historically managed LD services, and I think only once in my career history have I ever had an inspector that's had a background of learning disabilities, which has always posed a challenge. And I think actually we know from CQC inspectors, they obviously went on strike around the new single assessment framework. There were concerns that Teresa Coffey had highlighted around actually lack of knowledge from inspectors to be able to roll this out. I don't necessarily see that if they've all got no experience, because actually if they're utilising a system that the CQC has that is AI driven, they should all be putting in the same input. Whether that in reality actually works or not, I don't know. I mean, I like to think they're recruiting people that have got care background, but I think sadly I do hear a lot of registered managers, deputies, seniors that apply for a CQC and are told that they don't have the experience, and it kind of begs the question of what experience do you need to become an inspector?
Mm-hmm. Actually, this interesting point, especially you mentioned your background in learning disabilities. We also have a large amount of our customers who support people with learning disabilities. And is there anything in the new changes that will make the inspections more focused for these areas, or are we still at the whim of which inspector turns up?
No, unfortunately, we're still at the whim. And obviously, like we spoke about earlier, they're going to be prioritising if there's complaints and bits and pieces. And I know, comparing kind of my experience with older people in learning disability, there are generally more complaints in learning disability services with, parents and mental capacity, and providers on one hand saying that the people they support are more independent than maybe what relatives are saying that they think their child should be and doing. And yeah, I think it'll be interesting to see how the CQC evidence actually, how they're ratifying that feedback that they're getting via their website or from relatives and bits and pieces, because we know there's obviously that expectation versus reality of what's actually happening. And I mean, I talk about my own service in reablement. It's very clear when we start with people, it's up to 6 weeks. We'll review people along the way. And obviously, if people don't need visits, we'll reduce, because the aim is to leave people at the end as self-caring. But we know that relatives expect it for the full 6 weeks, because they know that from the government, everybody's entitled to 6 weeks free care. And that brings in a lot of complaints about actually how the CQC for my services and other reablement services going to quantify actually how they're using that as an evidence for whatever score they give.
Cool. I'm going to suggest we move on, because the next few topics, I guess we've covered what are the changes, but I want to get into some which are really about navigating the changes. So next topic to cover is, what should care providers avoid doing while these changes are coming through? So Mark, do you have any top tips of what to avoid doing?
I think the biggest thing from me, and it's great to see so many people join in, would be to bury your head in the sand and hope that it's not going to hit you, because it's coming. I think should avoid paying. I think it's good to maybe have an external consultant come in to educate your teams or circulate this video and the recording. But I know I've seen some people charging, thousands of pounds for something that still isn't 100% known. The CQC are still adapting kind of their information on their website. So you might be paying £1,000 and the next day the CQC could be updating it, and that's £1,000 loss, but actually that'll be ingrained in kind of your staff's mind. I think on the flip side to that, you should definitely be utilising resources that are out there. So obviously you've got your ebook, which you're going to talk about, The Caring View has a whole CQC suite. I think go on that CQC website. If you've read something, go onto their website and confirm that that's still the latest bit of guidance that they've given. I'd avoid printing things out, because no sooner have you printed it, they're changing it. I mean, when I look at the amount that's kind of changed since October and the amount of now evidence that we have and things like those best practice guidance that are now going to be compulsory, that was just a change overnight. And CQC don't necessarily communicate that. It's just kind of on the website for providers to find. I think utilize manager groups, hopefully some managers that are in down south that are kind of going through the inspection process now will share kind of what they've gone through. And it's just kind of networking in with other managers and other providers to see kind of how they're getting ready, what they're doing, sharing best practice as and when we have inspections, which I think currently under the new framework we do very well, and I don't think that will necessarily change. But yeah, definitely don't put your head in the sand and hope that it's not coming.
Mm-hmm. I mean, yeah, what about how to manage the changes with your team? You know, should you tell them about it, or should you just let them, you know, carry on with the current framework as it is for now?
I think for me is communicate it with your teams. We know that you need to bring staff on a journey. We know these are going to be big changes for the organisation and kind of what that data looks like. And we know that they're going to be collecting data from other sources, not just from the provider. So I think having that communication prevents kind of any misunderstandings if the CQC does happen to come knocking on the first day when they get to your region. I think be honest with staff and say that actually it's a learning process for the CQC. They're doing it in the south, they might make changes, and then it will move on to the next region. And actually it might look slightly different for our region than it does right now. I think share things like this webinar with them, because actually they can watch it in their own time. You could utilize it as part of a team meeting. But yeah, I definitely think having those conversations with staff, but also start having exercises around those quality statements. Maybe look at one a week, and actually how do we meet all of these? What are we currently doing? You know, around the sustainability, whilst the CQC haven't released their kind of guidance, as a team, you could be looking at the NHS sustainability guide, which they've kind of mentioned, but also look at what could we do as a team, either on if you're a group home, you know, across the whole organisation, or if you're an individual at a local level. And you know, for sustainability, it doesn't have to be massive. I think we always think of and hear about, you know, solar panels on the roof, and actually it could be, you could have a competition around, you know, how many ring pulls off cans, because there's a lot of charities that collect that. Whether you can do car sharing, you know, recycling batteries and have a battery point, and around those conversations that you're having with the people you support and your relatives. And I think, you know, we spoke there about staff, but I think it's equally important to make sure that your relatives and those key people that are in people's lives and the people you support are involved in these conversations as well, so they also know. Because I think it's also their data that is going to be shared maybe from a GP to the CQC, and think we should make sure that actually relatives and the people we support know that, so that it's not a big shock when an inspection report comes out.
I think that's a very good point. You know, everyone's going to have to be sort of brought on the journey together, and that's staff, families, you know, everyone, you know, service users themselves, all going to have to be involved in this. Okay, next up. So what are some key effective ways that care providers can adapt to these changes? So I suppose, Mark, you've already chatted about starting to get these discussions going in team meetings, but yeah, I mean, how are you doing it in your service?
So I think for me is, we know that the CQC want to update us. So I think one of the ways that we can adapt is making sure that we enrolled on whichever format that they're communicating that. So making sure that we follow them on social media, we're subscribed to the email bulletins. They're meant to be holding webinars every month. I don't think they're happening every month, but making sure that you're kind of updated on those updates from them. They have obviously the emails that go out weekly normally with all of the information. And I think make sure that your staff are also registered, or if they're not, you can, like in my team, I'll circulate those updates out so the whole team have got them, and I try and pull out the key changes that actually, for those staff that, you know, are operationally and a lot busier than perhaps I am, they've just got those kind of key changes at a very kind of high level. I think we know that the quality statements are out there, the evidence categories are out there, the scoring approach is out there. So I think those three things give you a really kind of good insight into what they're going to be looking at evidence-wise. So as a team, you can start pulling together that evidence and putting it under the relevant section. And it might be at the moment that you might have a folder, but you've now gone digital and you might actually want to capture that all digitally. I think have a look at what your digital system offers and the reports that you can pull from it. And is there data that you might not have utilized before, but actually going forward, you think would be beneficial to utilize or at least capture, so that, you know, when the CQC do come knocking, you can actually have that in your back pocket.
So Mark, are you starting getting that in your back pocket already? Have you got your set of evidence folders you're starting to collect for the new framework?
So I've shared it with my registered manager, and then underneath that there we have local business managers. I'm in a local authority owned company, so there's a lot of layers, and I appreciate the majority of people watching are probably from a small provider, and I kind of put my registered manager hat on, and I think actually you, the deputy manager, your senior staff, start sitting down and looking at these. I think if you're part of an organisation that's got a lot of services, and maybe you've got a quality manager or somebody, and the information normally feeds from the top, if that information hasn't started kind of filtering down, is having that conversation about when will information start filtering down. But at a local level, start having those conversations. And then obviously if it starts coming from above, then it starts coming. But I think don't wait for maybe your corporate teams to start filtering that down, because before you know it, we're going to be, well, we're 2 days away from December, and we'll be in the next region before we know it.
Okay, thanks, Mark. I think it's the last topic we've got planned, but how does having a digital social care record, becoming known as DSCR, play into these new changes? And yeah, I guess from our side, a lot has changed in the last few years, and how we might fit in, not least the fact that there is, of course, now the assured list of software providers who are, you know, assured by NHS to provide digital social care records. And of course, funding has been made available in most areas to push that digitization. But yeah, Mark, from your point of view, you know, have you seen benefits? Do you think DSCRs make it easier?
I think there's pros and cons, because I've managed services where you're only supporting 1 or 2 people, and I'm thinking here about supported living, where I've had people that I've supported that don't want to be on a digital system, and I think those are probably more rarer than the general providers across England. But I think it has, you know, I've definitely popped that forward to the CQC about, actually, if you're a provider and the people you support don't want to be digital, what is there? And at the moment, they don't have any advice on what to do around that. I think we know the CQC are moving to a digital era. I think we all know outside of social care, it's more digital. AI is all around us. It's evolving really quickly, and I think we need to get on board. I think if you're looking at going digitally, to kind of make sure that you know why you want to go digital. Don't do it because the new single assessment framework's coming or the government have got their 80% target. Do it because it's right for your service, your team, the people you support, and take those kind of steps to procure a service and look at that service. The CQC has said that they won't mandate digital records, but they have said that they will strongly advise providers to have it. Whether that will change in the future is anyone's guess. But I think if you're not a digital service, and I kind of think back to the last inspection I had, and they wanted, so we fall under a home care provider, they wanted the visit times, the plan versus actual, the care notes, the care plan reviews, stats on the staff mileage, stats on complaints, the number of compliments, our safeguards. And I kind of think back to the care home I was managing during the pandemic, which we weren't digitally, actually being able to provide all of that information, and most of our archiving wasn't kept in the building, would have taken us a humongous amount of time, and then to scan it and to email it. And whereas compared to a digital system where you're able just to pull that off in a report, password protect it and send it to your inspector, or to, obviously under the new portal going forward, the time savings are humongous. I definitely think if you're not digital, you should definitely look at going digital. I think we obviously spoke earlier about the DSPT toolkit that's now obviously gone. It's obviously guidance at the moment, but will be part of inspections going forward. But you can only really do that if you're a digital provider. So I think whilst they might not be mandating it, you're going to really struggle to get that kind of outstanding rating, and potentially good if you're not a digital service.
Yeah, thanks, Mark. I'm glad you brought up the thing about whether CQC will mandate digital records in the future, because I have seen and heard a lot of kind of false narrative around this. There are a lot of people who said, oh yes, CQC are mandating it, or they're going to, and we actually, within the last 6 months, had some really great clarity from CQC on how they're thinking about it. They're not. They've actually come out and said, we're not going to mandate, as you say, but things are going. The way that digital inspections and digital data provision to the regulators going, it's just going to get harder and harder to do the base job, even just reporting job, and not have a digital system in place. And I suppose this is, where myself as a technologist, I start to get more excited about the longer term future of actually how could this be made a lot easier for providers, and what if your digital system could send the right information with a click straight through to CQC, not even having to log into a separate portal, right? This updated portal is a nice step. It's a necessary first step, but ultimately, via APIs, systems like LogMyCare and others will, and this is probably 5-10 years out, right? Because CQC need to get their own infrastructure in. Like, we could move faster than them, but ultimately, I think data is going to flow straight from the digital social care records right to the regulator, and it's actually going to massively cut down on the amount of faff and time spent aggregating and producing reports to then put into another portal. So, I'm quite looking forward to that world, but it'll have to be done in a very controlled way, right? I think people would have a lot of reticence about data flowing through live, and we've had discussions with CQC about that, and so they know that the care providers won't want that lack of control of data going straight through. So I don't think we're going to get to that kind of world, but still a one-click or approval type mechanism of what you share, I think is going to happen.
No, and I think you talk there about 5-10 years. I reckon it'll be sooner than that. So I know I hosted a conversation with the CQC, which you can find on the Care in View YouTube channel. And the CQC, it was a really open, kind of honest conversation around digital and what that looks like in terms of providers. And that's there where they spoke about that they wouldn't mandate it, but they were talking about kind of plans for the future, and whilst nothing's set in stone, kind of what they aim for. And I think in that conversation I had there's a lot for providers and managers to be able to take away and actually think about in terms of the data that they might want to collect and pull and to utilize during inspections. But yeah, I think we're meant to work in a transparent and the duty of candor, and actually the CQC having access maybe not to personal identifiable data, but your number of complaints, the number of safeguardings at a high level complements. Actually, it'll take time away from care providers because you won't have to be sending it, and we know that they're going to want it anyway. And actually, CQC can look at that as and when they want to. And I would imagine as we move forward to these more frequent inspections, that's going to happen anyway. Like safeguardings, they're going to utilise the data from local authorities, and we're not going to know about it anyway. So this would be no different. It would just be coming directly from our service.
Mm-hmm. Mm-hmm. Cool. Look, I think we've got about 10 minutes left, so we're doing really well for time. And I thought we would then go into Q&A. So, Chloe, are you back with us to see if we've got any questions that have come through?
Yes, I'm back. Yeah, we have a few questions that have come through. So the first question is from Bailey, and Bailey's asking what other type of information will CQC gather other than the provider information?
Yes, so they're going to be gathering data from a range of different resources and places, and it is listed on their website. So we know that they're going to be taking that from community services. So it might be the local the day opportunity centre, that if you send people with a learning disability service to, if that's local authority run, actually they'll be able to tap into that through the local authority. If you've had an inspection from the local authority, that report, district nurses, from GPs, from Health Watch that also run kind of surveys within the local area, your data set that we fill in for Skills for Care, if we're using that. I think the capacity tracker, which obviously talks around, they obviously spoke about vaccination and they speak about mortality rate, which is kind of on that. And I think we'll probably see that tracker evolves over time, because that we have to complete regular, we have a responsibility to complete it, and we have to, otherwise we incur the fine. So actually, the more they add on to that, the more data they're going to be able to harness at any one time.
Nice. Yeah, and then the next question is, will CQC ask for access to the digital care records that the care providers are using?
I think this is a really good question, and I know one that's been put to the CQC many a time. So I think care providers have said that inspectors need to really be upskilled in each digital solution. I think CQC have said that it'd probably be near on impossible, because whilst you've got the assured provider list, there's also hundreds of companies that aren't on that assured list. But they have said that they expect their inspectors to have some knowledge of a digital solution. I think for me, I remember, going back probably 8 years when digital was very new, and I had a CQC inspector next to me for the whole inspection, kind of showing her the system. I think those days are gone. I think they're going to ask for the data they want to see. You'll be pulling it and sending it to them.
Interesting that, so we do a lot of work to actually remain on the NHS assured list, because they keep making the number of criteria we need to meet longer. But one of those is around being able to provide CQC inspectors with a dedicated login. And so that would be like, read only. They could access information remote for the time that you give them access. That's something we're actually working on at the moment. And so it seems like even for an on-site inspection, some inspectors might be given access to the reports ahead of time, and then come in and you might then, walk them through them side by side.
No, absolutely. So we know that they've said that actually for some of the quality statements, they might utilize that data and make a change to your inspection outcome and the rating. And then if they've got concerns or they need to elaborate further into that data, then they'll do an on-site visit, or they'll contact the provider to collect more information or clarify bits and pieces. So I definitely think there's going to be that discussion where data isn't clear. But I think in terms of, say, number of compliments and complaints, that's very granular. They're going to be able to see that, but then they might want to dive into actually what were the lessons learned and what have you done to resolve X, Y, Z, and steps to mitigate those risks.
Great. And then we have a question from Shaya, who's asked, do we know which providers are being inspected now with the new changes?
Yes, so right now, I'll do a search on my other laptop. So the south of the country is being inspected as we speak. So it started on the 21st of November. The CQC have said by the end of March 2024, all regions will be on the new inspection process. So the next regions to go live, so the next one is on the 5th of December, so which is what I was saying earlier, actually, before we know it, we're going to be into the next region. So that's going to be the South region, Bedfordshire, Luton and Milton Keynes ICS areas. On the 8th of January is going to be the London and East region. And then on the 6th of February is going to be North and Midlands regions and NHS Trust well-led assessments everywhere. Although a small number of providers will be invited earlier from the North and Midlands to take part. The changes with the date in London and East was brought forward by 1 day. I would hazard a guess, and this is just a guess, that the rollout in the South has gone well and there's no kind of key changes that I need to make, but I think they have said that they will make changes if needed. So actually that date for North and the Midlands might change as they inspect more and more providers across areas.
Great. And then we have a question from Sandra, who's asking, is the capacity tracker going to be updated as part of the move towards more interoperability?
Nobody's really spoken about the capacity tracker. I do think because it's a data set we have to complete and we're mandated to complete it, I do think there's going to be more information that we're expected to put into it because the CQC will be able to access it at the other end. So I think logically it makes sense for them to request us to have more data because then they're naturally getting it on a more regular basis.
I feel like it would make sense for that to all be in the new portal.
100%, yeah. And whether they do merge them into one, who knows? I know I've spoken to registered managers that might be in an ICS area and they're completing the capacity tracker. They're completing one for their local authority and one for the ICS. And I think my advice, if you're one of those registered managers, one of those regions, you probably really need to push back and say, actually, we're already filling in this data set for a system that is mandated. So we need to be doing it once. I know that's very hard with commissioners and bits and pieces, but the amount of time it takes to fill all of these in, actually, the argument would be that you could have more time with your staff and the people you support, and actually you'd have better outcomes than filling in information and data 3 times.
Nice. And then we have a question from Charlotte, who's asking, will CQC be asking for evidence pre or post inspection? Will we have much notice to pull it for them?
So I think they're going to be utilising the data that is out there in the public domain. So they might be collecting evidence pre-inspection, and like Sam said earlier, actually they'll then be able to turn up to that inspection with an informed kind of decision on what else they want to look at. I think the majority of it under the new assessment processes, they will obviously know what they want to inspect out of those quality statements. And my personal view is that you will only know that on the day. Definitely if you're a care home. I think home care, sometimes because the registered manager isn't always in the building on the premises, there's sometimes a 24, 48 hour window, and whether they share that information so that, you know, if they're remote working, they've got time to collate that. I don't know, but they haven't actually announced it, and I'm yet to find any providers that have been inspected under the new regime. But presumably under the new way of working, those providers would have known that they were going to be part of that anyway, so they probably had more time to prep and get ready.
Yeah, so well, it could be, if there's anyone here who has been inspected under the new regime, then please do contact us, and we'll put them in touch with you, Mark, as well. If you want to have a chat and see how it's gone, maybe we could get some new resources from people who've just been through it.
Yeah, no, definitely, that'd be good. I think the only thing I would say is you've got the quality statements and the evidence categories, is start mapping them now within your organisations and try and pull data into each one of those. I think the outstanding guidance under the old framework that CQC had was really good at mapping it against the CLOEs and what kind of evidence there could be, and they haven't released that. They have said that they've heard that providers have said that would be really beneficial, and they are looking into it. Whether that materialises into anything, who knows. I did share, if you go onto my LinkedIn, I did share last week across each day under each key questions, so you're safe, well-led, effective, responsive, caring, infographic of evidence ideas. So it's nothing outside of the box, but it just kind of puts it under each of those. And I think actually just being able to start pulling information, and don't go, don't dive all in, just choose one area, focus on that, and then move to the next area, because that they're not going to be inspecting against the whole framework. They're only going to be utilising and inspecting against 2 or 3, and using your good or outstanding report to pull that over.
Okay, cool. I think we probably have time for one more question before we need to wrap up. So we have a question from Christiana, who's asked, what steps can I take to keep an outstanding rating? Will these changes affect inspections as a new provider?
Very good question. I think it's going to be hard because they're obviously they're introducing those best practice that now aren't best practice. So I think if you're an outstanding provider, go onto that CQC website, find those best practice guides that they've released, and you probably want to start embedding them if you're not already. If you struggle to find them, drop me a message. You can find me on Twitter or X. Can find me on LinkedIn, on Facebook, drop me a message and I'll share those links out with people. So I appreciate that the CQC website isn't always the easiest to navigate.
Great. I think that's all we have in terms of questions. That was a really great session. Thank you so much, Mark and Sam, for all the insights, and a big thank you to everybody who attended. Before you go, we want to remind you that after the session, you'll be redirected to this CQC ebook, where you'll find more information about the new framework. You'll also be sent a recording of this webinar to your emails after this. But yeah, before you go, we'd love to get your thoughts on how the session went. So please go to the polls, which I'm adding in the chat now. Oh,
just while you're adding that, for anybody looking at that ebook, I had a look at it over the weekend and again this morning. It really breaks down that framework into step by step, a bit like the conversation we've had today, where it's just easy to digest, the perfect resource to be able to share with your teams and the people you support and their relatives. And you're obviously going to have a copy of it so you can email it out to people and they can come back with questions and bits and pieces. I think if you do have any questions off the back of it, please do reach out to me. I'm more than happy to kind of signpost you or offer advice where I can.
Great. Yeah, so you just need to go to the polls tab to fill out that feedback. But yeah, thank you everyone again for joining, and thanks again to Sam and Mark, and have a lovely week.
Thank you very much.
Thanks, everyone. Hope you found that useful, and thank you, Mark, again for joining us. Really great to have you.